The mental health profession is changing. Demographics, technology, and even college enrollment are all filled with uncertainty. With these things in mind, I can't help but wonder, what does the future look like for the field of mental health? Hello there, this is Bradley, and you're listening to Psych Everywhere, a podcast by Psych-I, the International Honor Society in Psychology. For this show, distinguished guests weigh in on applying psychological science to a diverse range of current events and to better your life. Listen for free wherever you go for podcasts, or see the link in the show note for a written transcript of this episode. This episode was made possible through a Psych-I sponsorship with the Alliant International University, California School of Professional Psychology. If you'd like to learn about graduate programs at CSPP, be sure to check out the link in the show notes for this episode. Who better to ask about the future of mental health than the upcoming president of the American Psychological Association? Presidents of APA determine society initiatives, and they even advocate with government and other organizations for policies and funding that support psychology and mental health services. For these reasons, I'm excited to welcome Dr. Debra Kawahara to Psych Everywhere. Dr. Kawahara is an incoming 2025 APA president, and she's the Associate Dean of Academic Affairs and Distinguished Professor at CSPP Alliant International University. No stranger to APA, she's also a member of the APA's Strategic Planning Advisory Group and has previously served as a member-at-large on the APA Board of Directors, as a representative on the APA Council of Representatives, and as an APA Finance Committee member. Dr. Kawahara is a multicultural feminist scholar whose work centers on intersectionality and social justice, women's issues, leadership, and integration of early Buddhism into psychotherapy. She's also a licensed psychologist with a private practice for working with individuals, couples, families, and consulting with organizations. She sounds to me like someone who's in a good position to lead an organization. Dr. Kawahara, welcome to Psych Everywhere.
Thank you for having me.
I wanted to congratulate you on being the president of APA.
Thanks so much.
I wondered, could you share with us a little about what does that role involve and how are you sort of preparing for it?
A couple of responsibilities that the president holds. One is leading the board of directors. The other is leading the Council of Representatives meetings. The other things that I do are represent the association, both domestically and globally, and communicate with the membership in terms of our association publications and other media outlets, just like this one. And then any other crisis or situations that need to be addressed by the association.
So I understand that you're also the first Asian American woman and the first Japanese American to serve in this role. And so I was wondering, in that light, what do you think this achievement means for you and for other Asian Americans?
So I'm going to go through what led me to run for the APA president role, because I think it actually explains why I chose to run. This was not a role that I ever thought that I would run for. But when the position came up, this was at a height of the anti-Asian hate and violence that was happening in the United States, and the issues around racism and kind of us being targeted just because of the way we looked. And then the conversation went to representation, visibility, and voice. And someone approached me and I had to seriously consider my position that I was in, given that I had done all of this leadership work within the association. And I felt like I was in a good position to run for the APA presidency role, I also felt like, I didn't know when the next person would be in the position that I was in. And also that there had only been one Asian American in the whole 130 so-called years of the association that was APA president. So I really seriously considered it. And I decided that I would run based on needing that representation, needing that voice at the table for particular issues that are important. But I also would say when I did decide to run, I had many students as well as early career psychologists who came up to me and said, just seeing you, the power of role modeling made them come up to me and say, it makes it seem possible that I could one day run for APA president. So I think the significance of it is really large. And I hope that I'm only one of many as time goes forward.
I saw that the theme of your campaign was strength and unity. So I like the sound of that. So I wondered, what are some of the key initiatives that you plan to focus on during your presidency? And, particularly pertaining to mental health professionals.
Yeah, so I'm really excited. I'm going to talk about two that I think show that strength and unity. The first one is engaging psychology's future. And with this initiative, what we are wanting to do is expose as well as excite high school and community college students to consider a career as a psychologist. So what we're going to try and do is do local events at high school and community college where they can meet local psychologists from different specialties. So anywhere from someone doing mental health services, someone else doing research or science, someone else doing organizational psychology. And what we hope is that by them seeing actual psychologists, learning about their stories, learning what they would advise them to do if they're interested in this career, we hope that they'll choose to, become a psychologist. And one of the things I'm hoping is that really anything that a student is interested in, you can probably find a niche in psychology to do with that interest. So that's one of them. The second, which I believe is so important, and I think we've been seeing natural disasters across the United States at more frequency. So whether it's a hurricane, wildfire, floods, what we're going to try and do is an initiative that focuses on disaster preparedness, response, and recovery. And what we would like to do is take lessons learned from the communities that have experienced this and have gone through recovery of it, looking at our psychological science. And we also have some experts from agencies that will help us put together a blueprint for communities to then take the information that we learn and then we hope to disseminate it to communities so that they can make it their own, because not every community is the same. They have diverse people, they have different resources, they have different strengths, but they also have areas that they're going to need to address should a disaster happen. And so what we're wanting to do is those communities take that blueprint and make it their own, but that they're ready for when a natural disaster comes and impacts their community.
This episode was made possible through a Psychi sponsorship with the Alliant International University, California School of Professional Psychology. That's CSPP. Founded in 1969, CSPP was one of the nation's first independent schools of professional psychology. Today, CSPP continues its commitment to preparing the next generation of mental health professionals and advocates. Their dedication to ensuring every community's access to quality mental health care extends from integrated care to inclusive family therapy. Explore their programs at https://info.alliant.edu/partner-psychi. And of course, I'll put a link in the show notes for that as well.
You mentioned diversity there and how not everyone's needs are the same. What do you think are some strategies that would be effective in attracting a diverse range of individuals to, pursue careers in mental health?
So thinking about this, I really think we need to go where they are. We can't just expect them to come to us and learn about our careers. So it's really important that we have community psychologists go out and try and get those people, those students that may not necessarily always think about psychology or mental health as a career. I know a lot of my peers when I was growing up, it was, their parents wanted them to do the conventional, be a lawyer, be a doctor, be an accountant, and psychology or mental health services was not something that would come to the top of mind. But we know that the United States is currently in a mental health crisis and that we have a shortage of mental health providers. And so part of this is saying there is a true need for this and that you could actually be a part of the solution in terms of this crisis that we're currently facing. But we got to get out to them, and we also have to support them as they're going through their education and training to become a psychologist.
Well, I love the idea of reaching out to high schoolers. About students, getting them into college, do you have any thoughts on this so-called enrollment cliff that we keep hearing about? Are there any things that APA and psychology departments can do to sort of weather that storm?
So APA has been focusing on this, what they have been calling the Great Enrollment Cliff, because we know because of demographics in 2008, where we saw a population decline, just the numbers are going to automatically decline in terms of those entering into college. So I think part of us trying to focus in saying, how do we get students interested in psychology and help them understand that what would you like to do with a career in psychology, and then trying to support them by giving them experiences that will make them competitive, but also gain the skills that they need so that they know that employment is a possibility at the end of their training.
What role do you see, like technology, and I see more and more talk about telehealth. What role do you think these things play in the future of mental health services, and is APA doing things to support those?
Oh, yeah. And I think one of the things that people may not be aware of is that psychology has been involved in technology for a long time, from like even World War II, where they were helping the military figure out, okay, what would be the best way to utilize our military personnel, looking at the planes to make it psychologically easy to use. So human factors. It has been something that psychology has been involved in for a long time. But APA knows that AI and technology are going to impact us as a society. It already is. And so APA recently, at our last Council of Representatives meeting, has decided to make AI and technology a priority in terms of the things that we're doing. Whether it's research on it, because we know that algorithms such as bias and discrimination can be permeating the data that was collected. And that needs to be then teased out. technology. So some of the things that are being used for mental health are digital applications. So making sure though that those digital applications are effective in whatever mental health interventions they're serving. So those are the kind of things that APA is doing.
If someone's listening to this right now and they feel inspired to become a future APA president, I wouldn't know where to begin to do that. So I wondered, could you share some steps? How do you get that started?
Yeah. Well, like I said, I did not plan on this path. I mean, there are some people that do, but I didn't. What I did is I kind of followed my values and interests, which then led to me doing things that, building my skills, building areas of interest. And the CEO of APA kind of said this, and I really believe in it. You want to prepare so that you're ready for opportunities that are presented to you. And I think that's really important that, as I have gone through my career, there have been opportunities that I would have never thought of, being presented to me. But either I had an interest or they saw a skill that I had, or they thought I was going to be good, right, at it. And then I was willing to go for it, to take a risk and, get involved, engage. And so I would say really try to know yourself, know your values, know your priorities, and then work to get those experiences that are going to align with your values and kind of what you're wanting to do.
I imagine that after you were elected, that it was helpful because you're technically a president-elect, right? And then you start being president. So I imagine that was helpful in itself, that you got to see what the current president's doing and how they would go about things and, what's possible and isn't and things like that. What's that like working with the others, and how does that kind of teamwork come in handy?
Yeah, I would say, I've been able to be president-elect, and then I was 2 years on the board. That has been very helpful in my preparation to take on the presidency in January. I think what is important is that the group has cohesiveness and that we work together. But I guess an important piece of that also is the diversity of perspectives, that we can come together with multiple perspectives. And hopefully through our multiple perspective, we converge to get the best outcome or option for the situation. So I really see that as really important in terms of a group.
I have a hard time picturing being a president of anything. You know what I mean? It seems very big. So how does it compare to like things you do at like CSPP, like the people you work with and things like that?
I actually think that it has prepared me well. In my role as Associate Dean of Academic Affairs for CSPP, I oversee over 20, along with the dean, oversee over 20 programs across 6 campuses and our online program. And so the various groups and their agendas and, issues that come up across all of the faculty, staff, students, even outside of the institution, and that the systems within the university as well as outside the university, I think have helped me prepare in that I have to understand systems, the interplay of all of these different groups and levels of the system and dynamics and politics.
Well, I'm looking forward to your presidency. Is it calendar year? Does it start? When does it start?
It starts January 1st, and
Cool.
I go all the way to December 31st, 2025.
All right. Well, I really appreciate you talking with me today, and I look forward to kind of following along with you this year and seeing how things go.
Great. Thank you so much for having me.
Thank you so much for joining us. Thanks for listening to another episode of Psych Everywhere.
Did you know that PsyChi is also seeking to increase its support for future generations of mental health advocates? We're currently raising funds for the Christian Ladd Hall Scholarship for Mental Health Advocacy. Christian Ladd Hall was a young man whose life was impacted by bipolar disorder 2. To honor Christian, this scholarship will annually support one undergraduate or graduate student seeking a career in mental health advocacy. Once fully endowed, a yearly recipient will receive $3,000 and can request an additional $1,000 to create and offer a mental health event in their community. To learn more or donate to this scholarship, please visit the link in the show notes. If you haven't already subscribed to Psych Everywhere, go ahead and follow us wherever you go for podcasts. Tell a friend or a colleague about the show. Word of mouth is a huge help, so share what you learned at the dinner table or in your classes. You can also follow us on X at PsyChi Podcast and leave a review at Apple Podcasts. You'll absolutely make my day, and more importantly, you'll be helping us to get Psych everywhere. Okay, that's all for now. I'll connect with you again soon. Copyright 2024, PsyChi, the International Honor Society in Psychology. All rights reserved.